Hi there, my name's Charlie Lees. I'm a gastroenterologist in Edinburgh, and in this short video I want to just provide some updates about COVID-19 for people with inflammatory bowel disease. There is no doubt that we are in a very dangerous phase of the pandemic. The new variant has shown to be at least 50% more transmissible. So whilst it doesn't increase the risk for an individual person once they have COVID-19, it does make it more likely that the virus will spread from person to person. And that is largely responsible for the surging cases that we're seeing in the UK and in Ireland. It's notable that the cases have been surging in the United States for some while now too. It makes it very important that we comply as best we can with the lockdown measures that have been put in place across the 4 nations here and in many other parts of the world to stop the virus transmitting from person to person, bearing in mind that it is an airborne virus, so it really is contact with other people in confined spaces, indoors in particular, where the risk is so great, which is why mask wearing as well as social distancing, minimizing contacts as well as hand washing is so very important indeed. For people with IBD, thankfully, there does not seem to be much of an increased risk with COVID-19 disease. We last year set out this risk grid for people with IBD in terms of the highest risk group that were to undergo shielding, a moderate risk group that is most of our patients, as well as some in a lower risk group. The table here is quite complex, and we have simplified this with an online tool that Nick Kennedy generated for the IBD registry in collaboration with the British Society of Gastroenterology and Crohn's and Colitis UK. You can go here to this web address, ibdregistry.org.uk/COVID-19, and that will give you an idea of your risk categorization based on the information that you input. This does change from time to time depending on your situation and the medications that you are on, so it's recommended that you go back and check intermittently to make sure that this hasn't changed substantially. These things are all important now because we're coming towards vaccination. Vaccination has been rolled out, of course, already in the United Kingdom with 1.5 million people given the first dose already. I'm not going to go into this into too much detail just now, but suffice to say there are 3 vaccines that have currently been shown to be effective and safe and now approved for use in the UK by the MHRA, and they are, of course, the Pfizer vaccine, the Oxford AstraZeneca vaccine, and just today the Moderna vaccine. 2 others on this table here from Janssen and Novavax should be reporting their key phase 3 data in the next month or so. We think it's very important that IBD patients get vaccinated, and indeed this is recommendation 1 from the newly released BSG documentation that you can find online at bsg.org.uk/COVID-19 advice. So here we are, top 3 recommendations. We strongly support vaccination for patients with IBD. We think the risks of vaccination in IBD patients are anticipated to be very low. And whilst there is a perceived potential decrease in the optimization of vaccine responses in patients taking immunosuppressant drugs, such as infliximab, adalimumab, azathioprine, etc., we don't think that this is a reason for patients not to get vaccinated, and this is something that we will study. Importantly, patients should not stop taking their therapy for IBD at any stage without consulting with their doctor, and specifically they shouldn't look to stop taking a medicine on the chance that they might get a better vaccine response, because we don't believe that will be the case. There is a lot of great further information for patients with IBD and vaccines on the Crohn's and Colitis UK website, and you can find that information here. A couple of final points. Firstly, we are all very aware of the impact of COVID on people's mental health. This is a very difficult time. It's a very difficult time of year for many people anyway. And the next 2 or 3 months, I think, will be tough with lockdown, people working from home, the challenges of homeschooling, etc., along with worries about general health. So please do not struggle in silence at home. Please call someone and ask. There are some resources here on the screen. This, I think, is very important. And then in addition to that, I would just say that the NHS, whilst busy, remains open for business. So if you are having a flare with your IBD, please get in touch with your local team. And we are here to do the very best we can to help you through this. Here are some key resources that you can get further information on. In the meantime, please stay safe, be kind to others, and reach out if you are struggling. Thank you very much for listening. I'll come back with some more information shortly.